Doctor, I also get tensed when I go to doctors and I get anxious when my BP is taken. It is often found high. Do I have hypertension?
Most of the patients do get anxious. For example, मैं कोई डॉक्टर के पास गया तो their anxiety builds up. Oh my God, what doctor will say, what will happen now, and that anxiety builds up. That anxiety creeps in and automatically the blood pressure starts rising up, the pulse rate may also go up, and at that time the doctor may find out it is 150 by 90 or 150 by 100 or 160 by 100 and you have a high blood pressure करके label लग जाता है, which is actually untrue. This concept is called as white coat hypertension or a blood pressure which gets mildly elevated or for that matter elevated in real sense when you visit a doctor, when you visit a clinic, when you visit a hospital. But that necessarily means that patient needs to be reviewed frequently on the blood pressure levels, and he has to check at home also and confirm that whether he actually has high blood pressure or not. Remember, a hypertension definition is a chronic high blood pressure state. It is not blood pressure just happening with a single reading.
What are the complications of hypertension?
Hypertension, as we know, is a very serious disease. The reason being that generally the blood flow to various parts of the body keeps on reducing. So high blood pressure gives rise to very serious complications in due course of time. मतलब आँखों में इफेक्ट आएगा, ब्रेन में इफेक्ट आएगा, हार्ट में इफेक्ट आएगा, किडनी में इफेक्ट आएगा, नसों में प्रॉब्लम्स आ जाती है. So let us begin one by one. आँखों के अंदर you can get massive bleeding, retinal hemorrhages, you can get severe blindness because of the ischemic event which can happen in the optic nerve. Brain में, as you know, brain hemorrhage can happen, acute strokes can happen, dementia can happen, memory loss can happen. So all these serious diseases of the brain can be contributed by hypertension. On the heart, we know it can contribute to heart failures, swelling in the heart. There can be a serious form of heart attacks, anginas, and in addition, we also get what is called as dilated cardiomyopathy. Beyond that, kidney functions can get badly affected. The blood flow to the kidney can get reduced. You can get into elevated creatinine, acute renal failure, chronic renal failure can happen. There is proteinuria which can happen. Slowly things can go very bad. Situation can go so bad that ultimately you may require dialysis also. Similarly, things can go bad in the limbs also. Peripheral vascular disease can strike because of hypertension, and there can be reduction in the blood flow to the lower limbs also, which can contribute to claudication, severe pain in the legs while walking, etc. Basically, anywhere the blood flows, it contributes to high blood pressure contributes to damage. So one has to be extremely careful about noting the disease and taking adequate measures.
What should be my target BP?
So when you are having high blood pressure, the doctor gives you the prescription in terms of lifestyle modification. He gives you treatment in form of some medications. We try to achieve a target. The target is ideally to keep blood pressure below 120 by 80. So in case 130 by 80 also is not a bad reading. So it depends on person to person. For example, the patient has a lot of complications, so ideally we try to achieve the BP below 130 by 80, and if you can achieve 120 by 80, why not? This is one of the good blood pressure also.
Can I monitor BP at home? Is it reliable?
BP can be easily monitored at home. We have very lovely equipments, electronic equipments which are available. So there are two very important points which I want to tell you. First is, how do we measure the blood pressure at home? Well, to be very simple, rule number one, patient should be sitting comfortably on the chair. Patient should not sit crossed-legged. He should not have tea or coffee at least for half an hour. He should not do any kind of exercise for at least half an hour. He should be just comfortable with his singular temperature. And the BP measurement should be at the level of the heart, and it should be tying the appropriate size cuff on the arm. And then he can check the BP. There can be reading 1 and reading 2. He can take the average of that. But there are a lot of technical advances in the form of checking the blood pressure through the watch, certain cuffs are tied across the forearm, which is not very reliable. So electronic equipments which are tied across the arm is fairly reliable. You can take two averages and it can give a fairly accurate reading. You can really do it at home.